they like the shade.
Wait, don't do that.
You have to stop what you are doing.
But why?
You are hurting this animal.
Huh?
Whoa, hold up. What does that situation have to do with our research, right? Well, I would like to introduce to you our 3D printed organ-on-a-chip platform. To give some context, the modern concept of organ-on-a-chip or OoC technology gained significant global attention following the breakthrough of lung-on-a-chip, a model created by He et al. In 2010. This demonstrated that microengineered systems could successfully replicate the complex human organ-level mechanical and physiological functions. Shortly after, a major initiative led by Donald Ingber's laboratory worked to develop 10 human organ-on-a-chip, focusing initially on liver and kidney models for predictive drug toxicity testing. Already? It's nighttime already? Anyways, why is this so crucial right now? Even in 2026, many major corporations still rely on animal testing for their cosmetic and clinical trials. According to the data from Cruelty Free Kitty and PETA, over 268 companies continue this practice. Our project offers a direct, cost-effective alternative to animal testing. By leveraging microfluidics, we align our work with key United Nations Sustainable Development Goals, especially SDG 3, SDG 9, and SDG 12. Ultimately, organ-on-a-chip or OoC technology offers a scientifically superior, cruelty-free path forward for research and drug development in the future.
Drug development has traditionally relied on animal testing to evaluate the safety and effectiveness of new medicines. However, animal testing has several limitations. Besides raising ethical concerns, models do not accurately represent human psychological responses. As a result, some drugs that appear safe in animals may still cause harmful effects for humans. To address this issue, organ-on-a-chip technology has emerged as a promising alternative. These microengineered devices are designed to mimic the structure and functions of human organs, allowing researchers to conduct more accurate drug testing. Despite its advantages, the widespread adoption of organ-on-a-chip technology is limited because existing systems are expensive to manufacture and require sophisticated equipment and complex fabrication processes. These high costs make the technology inaccessible to many universities, smaller research institutions, and laboratories with limited budgets, restricting its use in biomedical research. Therefore, our research proposes an affordable 3D printed organ-on-a-chip platform for accessible biomedical research. By utilizing 3D printing technology, we aim to reduce fabrication costs and simplify the manufacturing processes while maintaining the essential functions of conventional organ-on-a-chip systems. So this innovation has the potential to make advanced biomedical research more accessible and support the development of safer and more effective drugs. Wait, who's that? Watch me get her. You wanna see a magic trick? Sure.
Wait, why am I here? The solution. To bridge this gap, our team proudly presents our research project, which is design optimization of an affordable 3D printed organ-on-a-chip platform for accessible biomedical research. The primary focus for this is democratize organ-on-a-chip technology by leveraging accessible and consumer-grade 3D printing. Through CAD design optimization and computational fluid dynamics (CFD) simulations, we have engineered a microfluid chip specifically focused on a liver-on-a-chip model. It preserves essential biomimetic functions and fluid dynamics while reducing fabrication costs drastically by over 99%. This initiative directly aligns with the UN SDG, specifically SDG 3 for good health and well-being, SDG 9 for industry innovations, and SDG 12 for responsible production. We aim to prove that high-performance biomedical testing tools no longer need to be luxury, paving the way for a more accessible, cruelty-free scientific future.
Turns out, the biggest obstacle to innovation is not the engineering.
It was the price tag.
So before we print everything, we validated the design using console multiphysics, and the simulation showed a stable laminar flow with a Reynolds number of 0.55 and a physiologically relevant wall shear stress. Basically, we tried to make everything possible before we spend the money.
So how exactly do we build this innovation?
Well, first, redesign. And we optimized the organ on the chip in Autodesk Fusion 360. Well, the microchannel dimensions were scaled to match the resolutions of desktop SLA and also the IBM 3D printers, eliminating the need for expensive photolithography.
But can they actually afford this?
Well, that's the best part. So, to estimate the fabrication cost, we based on this formula, where the CAD model volume multiplied by the material density and multiplied by the material cost per gram, and that gives us the material cost per chip. How about the numbers? Based on our results finding, we found that 2.4 cm cubic is our volume for CAD, and based on the 1.15 gram per centimeter cubic for SLA resin and 0.55 per gram per ringgit, and that gives us 152 cents per chip for using SLA 3D printing. And for FDM 3D printing, it is only about 33 cents. So previously, we found that in the ranging of 630 ringgit to 1,360 ringgit, we get to minimize that cost by 99.5% to 99.9%.
This study successfully validated theoretical reusability, fluid dynamic efficiency, and financial accessibility of a 3D printed organ-on-chip platform. While computational models cannot fully replace live biological factors like immune responses or cell metabolism, our simulation framework establishes a validated foundation. The future step will focus on physical SLA fabrication, cytotoxicity testing, and lifestyle seeding. By bridging the gap between high-tech microfluids and low-cost manufacturing, we take a vital step forward, accessible biomedical research, and a confident cruelty-free future. And lastly, we can reduce animal cruelty.